Okay, so as you guys can clearly see, I am so tired, but I need to study. So, being a single mom and having to do everything plus study for family nurse practitioner boards is, well, not even boards, but just for a class right now. I'm in pharmacology. So I am going to basically read to myself so that I can stay awake. And if somebody happens to get on here and want to study too, like that's totally cool. Looks fuzzy. Let's see. Give me 1 second here. And it could just be the lighting. I hate this lighting. But anyway, so okay. So where was I? So we're gonna start this we're gonna start in the endocrine. Okay, so drugs affecting the endocrine system. So both men and women experience bone loss with aging. The bones most likely demonstrate significant loss are the femoral bones. So the femoral bones are usually the bones that experience the most loss with aging. Okay, now we have bisphosphonates. Bisphosphonates treat or prevent osteoporosis by inhibiting osteoclastic activity. Osteoclast. Okay, and then the prophylactic use of biphosphonates is recommended for patients with early osteopenia related to long-term use of which of the following drugs? That drug would be glucocorticoids. Let's see. Patients with cystic fibrosis are often prescribed enzyme replacement for pancreatic secretions. Each drug has lipase, protease, amylase components, but the drug is prescribed in units of lipase. Okay. I'm so sleepy. Okay, sorry. So, next question. Page 2. Page 3. Okay, brands of pancreatic enzyme replacement drugs are about the same in cost per unit of lipase across brands. Next question. When given subcutaneously, how long until neutral protamine, hagedorn, insulin begins to take effect? What is the onset of action after administration? It's usually 60 to 90 minutes. That's roughly an hour to an hour and a half. Right? Let me check my phone. Okay, so Oh. Okay, so hypoglycemia can result from the action of either insulin or oral hypoglycemic. Signs and symptoms of hypoglycemia. If you're a nurse, you should know this. It's dizziness, confusion, diaphoresis, which is like sweating profusely, and then tachycardia, which is having a very fast heart rate. I think it's usually above like 120. Okay, so non-selective beta blockers and alcohol create serious drug interactions with insulin because they mask glucose levels. So non-selective beta blockers and alcohol should not be taken with insulin. Some coffee here. Okay. Okay, so Lispro is an insulin analog produced by recombinant DNA technology. Which of the following statements about this form of insulin is not true? So the answer to that would be the duration of action increased when the dose is increased. So that's not true. So the action of the Lispro insulin does not increase. The duration does not increase when the dose is increased. That's just more coverage if you need it. So the decision may be made to switch from twice a day. The decision may be made to switch from twice daily neutroprodamine, Hagedorn, or NPH insulin to insulin glargine to improve glycemia control throughout the day. If this is done, and the answer to this is the initial dose of glargine is reduced by 20% to avoid hypoglycemia, which is low, like a low blood sugar. Okay, so there we go. My highlighter. Okay, so when blood glucose levels are difficult to control in type 2 diabetes, some form of insulin may be added to the treatment regimen to control blood glucose and limit complication risk. Which of the following statements is accurate based on research? That would be actually newer premixed insulins are better at lowering your HbA1c and postprandial glucose levels than long acting. So the newer ones are better in that instance of when you have difficult to control type 2 diabetes. Okay. So metformin is a primary choice of drug to treat hyperglycemia in type 2 diabetes because it decreases glycogenolysis by the liver. And actually, I was going to look up that word because I don't even know what it means. So let's see. Glycogenolysis is the biochemical pathway in which glycogen breaks down into glucose, 1-phosphate, and glucose. Let's see if we can find a little simplified answer. The symptoms of mild to moderate hypoglycemia, which is symptoms of glycogenolysis, include shaking, sweating, hunger, and headache. And you want to alert the person to consume carbs. Regulation. Glycogenolysis is regulated hormonally in response to blood sugar level by glucagon and insulin stimulated by epinephrine during the fight or flight response. Insulin potentially inhibits glycogenolysis. In myocytes, glycogen degradation may also be stimulated by neuroscience. Okay. So that's what it is. So it's like a breakdown of glucagon. Okay, prior to prescribing metformin, the provider what should they do? They should draw a serum creatinine to assess renal function. What I'm finding as I study is that most drugs Um, most drugs affect the kidneys, so that's something you always want to pay attention to when you're prescribing medicine to patients. Next, the action of gliptins is different from other anti-diabetic agents because they act on incretin system to indirectly increase insulin production. So let's say it again. The action of gliptins is different from other anti-diabetic agents because they act on incretin systems to indirectly increase insulin production. So sitagliptin has been approved for monotherapy and once daily doses and combination therapy with metformin. That's sitagliptin. Okay, that's a drug. And then we have a GLP-1 agonist, which directly bind to a receptor in the pancreatic beta cell. Okay, avoid concurrent administration of xenotide with which of the following drugs? So it would be digoxin, warfarin, and lovastatin. So the drug exenatide, and if I'm saying that wrong, somebody correct me. It's exenatide. Okay. Administration of exenatide is by subcutaneous injection, and it should be given 60 minutes prior to the morning and evening meal. So it's a drug you want to give like an hour before, not like 30 minutes before. Let's see. Okay, so we went over that. That was that, right? Let's just make sure because I am known to skip a thing or two. So some of the endocrine stuff there. Okay, so this is sorry. So this is hyperthyroidism and hypothyroidism. When methimazole is started for hyperthyroidism, it may take blank to see a total reversal of hyperthyroid system. So it usually takes about 6 to 12 months to start noticing any changes. In addition to methimazole, a symptomatic patient with hyperthyroidism may need prescriptions for a beta blocker. So, if a patient is symptomatic with hyperthyroidism, they may also need that beta blocker. Okay. After starting a patient with Graves' disease on antithyroid agents such as methimazole, patient monitoring includes TSH and free T4 every 1 to 2 weeks. That's a lot, right? Oh gosh, I could not imagine. A woman who is pregnant has hyperthyroidism. Hyperthyroidism is best managed by a specialty team. Sorry. Told you I'm tired. That's why I'm doing this video. Woman who is pregnant has hyperthyroidism and is best managed by a specialty team who will most likely treat her with PTU, which is propylthiouracil. Okay, so if a pregnant woman has hyperthyroidism, that's most likely what she'll be treated with, which is the PTU. Okay. Goals when treating hypothyroidism with thyroid replacement includes resolution of fatigue. That's one thing. Like people who have low functioning thyroids, they tend to have a lot of fatigue. They're really tired and just sluggish and just don't want to do anything. So that would be one of the goals compared to the other. Oh, stop yawning. Okay, so when starting a patient on levothyroxine for hypothyroidism, the patient will need to follow up measurement of thyroid function in how many weeks or months? Anybody know? It's actually in 2 months. 2 months after starting levothyroxine, you need to have a follow up. Once a patient who is being treated for hypothyroidism returns to euthyroid with normal TSH levels, he or she will be monitored with TSH and free T4 levels every 2 weeks. So, if um, if a patient who is being treated for hypothyroidism returns to euthyroid with normal TSH levels, he or she should be monitored with TSH and T4 levels every 2 weeks. And if we remember correctly here, no, that was something else. Never mind. Oh, wait, that's right. Remember also after starting a patient with Graves' disease on an anti-thyroid agent, and that could be their first, like methimazole patient monitoring include. They still need to be monitored with the TSH and the T4 every 1 to 2 weeks. And then a patient who has a recurring hyperthyroidism. Wait a minute. Once patient being treated okay. A patient who had hypothyroidism has returned to normal TSH levels. They want to monitor those every 2 weeks to make sure they maintain that. So treatment of a patient with hypothyroidism and cardiovascular disease consists of Liotrix. It's a medication. Infants with congenital hypothyroidism are treated with levothyroxine. Yes, levothyroxine. When starting a patient with hypothyroidism on thyroid replacement hormones, patient education would include drug adverse effects such as lethargy and dry skin that may occur, okay? So, starting a patient with low thyroid on thyroid replacement hormones, that's something you need to educate them on the adverse effects, such as lethargy and dry skin, okay? All right, moving on. All right, my little gold clips here. I think they're cute. Okay. Okay, so let's talk about drugs that affect the reproductive system. Men who use transdermal testosterone gel, are also known as androgel, should be advised to avoid skin-to-skin contact with pregnant women while using that type of gel. Okay, cause harm to the fetus. Okay, education when prescribing androgens to male patients include advising that cholestatic hepatitis and jaundice may occur with low doses of androgens. Sorry, I don't have the rationale right now, and I'm too tired to look at all this up. So, okay, as you can tell, because I continuously keep yawning. Okay, so potentially fatal granulocytopenia has been associated with treatment of hyperthyroidism with, oh my goodness, the PTU medication. Patients should be taught to report fever and sore throat. Elderly patients who are started on levothyroxine for thyroid replacement should be monitored for tachycardia and angina, of course. So, patients taking the PTU, the propyl thiouracil, they should report fever and sore throat. And any elderly patient that have been started on levothyroxine should report tachycardia or angina. Which of the following is not an indication that growth hormone supplements should be discontinued? That would be complaints of mild pain. I'm sorry, and I said the question wrong. It's actually which of the following is not. Oh, I'm sorry, I did say it right. Which of the following is not an indication that growth hormone supplement should be discontinued? And it's complaints of mild bone pain. Besides osteoporosis, IV biphosphonates are also indicated for Paget's disease. What is the role of calcium supplements when patients take biphosphonates? That would be they must take in sufficient amounts to provide foundational elements for bone growth. So, what is the role of calcium supplements when patients take biphosphonates? But the answer is they must be taken in sufficient amounts to provide foundational elements for bone growth. Which of the following statements about pancreatic enzymes is true? That would be dosing may be titrated according to the decrease of steatorrhea. There's another word I don't know. Steatorrhea. Yeah, I definitely spelled that wrong, so I'm not saying it right. Let's see. Steatorrhea. Okay, which of the following statements about pancreatic enzymes are true? Dosing may be titrated according to the decrease of steatorrhea. I can't find a word to say it for me. Let me see. Steatorrhea. Oh, then it pulled up Victoria. Well, anyway, steatorrhea, Steatorrhea, is oily stools. Oily stools can have a cause that aren't due to underlying disease. Examples include eating foods with cholesterol or medication side effects. So that is oily stools. Besides cystic fibrosis, which other medical state may trigger the need for pancreatic enzymes? And that is some bariatric surgeries. Besides cystic fibrosis, which other medical state may trigger the need for pancreatic enzymes? Okay, some bariatric surgeries. What we say about androgel, men should not get close to pregnant women, and when prescribing androgens to male patients, include advising about cholestatic hepatitis and jaundice that may occur with low doses of androgens. Okay. Let's see here. Let's get one. Double check. Give me a second, folks. There we go. Okay. Men who use, wait a minute. Let me just read this one. Okay. Oh, well, I skipped something quite apparently. I think okay, so I went to endo. Hey, we got through all the endo though. Right, there it is. So that was endo, the last one we did. Sorry. Okay, so drugs affecting the reproductive system. We already talked about skin contact with pregnant women while using the gel, and then the cholestatic hepatitis and jaundice that may occur with low doses of androgens. Okay, so patients who are prescribed exogenous androgens need to be warned that decreased libido may occur with androgen therapy. The U.S. Food and Drug Administration warns that androgens may cause pilosis hepatis, not hepatitis, hepatis, hepatis, hepatis. Monitoring for a patient who is using androgens include evaluations of lipid levels and liver function tests. Male patients require a digital prostate exam before and during the androgen therapy. I know that's not fun. Absolute contraindications to estrogen therapy include that would be clotting disorders. So we will want to give estrogen therapy to women or men in some cases who have a history of clotting disorders. Okay, postmenopausal women with an intact uterus should not be prescribed estrogen alone. Okay, women who have migraines with aura should not be prescribed estrogen because of an increased risk of stroke occurring with estrogen use. A 22-year-old woman receives a prescription for oral contraceptives. Education for this patient includes counseling regarding decreasing or not smoking while taking oral contraceptives. You don't want to you don't want to smoke and take those all at the same time. Moving on. Okay. So a 19-year-old female is a nasal staph aureus carrier and is placed on a 5-day rifampin for treatment. Her only other medication is combined oral contraceptives. What should she receive during her medications? So she should receive a backup method of birth control, such as condoms, for the rest of the current pill pack. So you want to give them protection, okay? Wrap it up, whatever. A 56-year-old woman is complaining of vaginal dryness and dyspareunia to treat her symptoms with the lowest adverse effects. She should be prescribed vaginal estridiol ring. Okay. Shannon is receiving her first methoprogesterone, which is the Depo-Provera injection. Shannon will need to be monitored for depression. Yeah. A lot of drugs you take like that, you have to screen for depression and make you depressed. When prescribing Depo-Provera injections, essential education would include advising of the following potential adverse effects: depression, and weight gain. I am getting sleepy. Okay. Depo-Provera injection has a black box warning due to decreased bone density. Okay, so Shayna received her first Depo-Provera injection 6 weeks ago and calls the clinic with concern that she's been having a light period off her own since receiving the Depro. What would be the management of Shannon? So we want to reassure her, and some spotting is normal in the first few months and of Depo on it. So we already read these. Okay. Moving right along. Oh, this coffee is not helping. So William is a 62-year-old male who is requesting a prescription of Viagra. He should be screened for, we already know, unstable coronary disease, anything to do with the heart, especially in the elderly. Men who are prescribed Viagra need ongoing monitoring for development of chest pain or dizziness. That's a R for. Oh, okay. Men who are prescribed erectile dysfunction drugs such as Viagra should be warned about the risk for fatal hypotension if combined with nitrates. Okay. Androgens are indicated for symptomatic treatment for male deficiency, female libido, endometriosis, postmenopausal symptoms, and symptomatic treatment in both sexes for cancer and HIV. Okay, so that's that. Long-term use of androgen requires specific laboratory monitoring of calcium, testosterone, PSA, liver function, glucose, and lipids. Wow, I am literally falling asleep. Where are we? Long-term use of androgens requires specific laboratory monitoring of, I just said this, calcium, testosterone, PSA, liver function, glucose, and lipids. Effects of estrogen include regulation of the menstrual cycle, maintenance of bone density by increasing bone reabsorption, maintenance of the normal structure of the skin and blood vessels. So it was actually 3 and 4. 3. All right, I will not go to sleep. Somebody keep me awake. I'm pretty pathetic. Put up a video and go to sleep on it. Okay, we're gonna talk about diabetes. Oh God, help me. This coffee sucks, and I have to be up at 5:30, and it's 1:30 Eastern Standard Time. Whatever. Type 1 diabetes results from autoimmune destruction of the beta cells. 85 to 90% of type 1 diabetics have autoantibodies and 2 tyrosine phosphates. Type 2 diabetes is a complex disorder involving a suboptimal response of insulin sensitive tissues in the liver. Go kind of fast, so I'll stop falling asleep. Diagnostic criteria for diabetes include symptoms of diabetes plus casual blood glucose greater than 200. Okay. Let's try this. Routine screening of asymptomatic adults for diabetes is appropriate for Native Americans, African Americans, and Hispanics. I guess we don't go to the doctor enough. Screening for children who meet the following criteria should begin at age 10 and occur every 3 years after. BMI above the 85 or 85th percentile for age and sex, family history of diabetes in first, second, or third degree relative, hypertension based on criteria for children, and that would be all of the above, everything I just read. Insulin is used to treat both types of diabetes. It acts by increasing beta cell. I'm sorry. Insulin is used to treat both types of diabetes. It acts by increasing peripheral glucose uptake by skeletal muscles and fat. So it brings that glucose down. So it works on it. I like that. I remember it. Okay, Adam has type 1 diabetes and plays tennis for his university. He exhibits knowledge. He exhibits a knowledge deficit about his insulin and his diagnosis. He should be taught that he should increase his carbohydrate intake during times of exercise. So he needs to make sure he's eating plenty of carbs so that he doesn't become hypoglycemic. Insulin preparations are divided into categories based on onset, duration, and intensity of action following subcutaneous injection. Which of the following insulin preparations has the shortest onset and duration of action? So according to this, we have Lispro, glucosine, glargine, and detamir. And the answer for this one, it would be the glucosine. The drugs of choice for type 2 diabetes is metformin. Metformin decreases glycogenesis by the liver. And we talked about that in the other chapter anyway. So before prescribing metformin, the provider should draw a serum creatinine level to assess renal function. But I feel like I'm bringing the same thing. There's one. There we go. So we dig over these. So we're going to remember type 1 diabetes results from autoimmune destruction of beta cells. It's autoantibodies into tyrosine phosphates, a suboptimal response of insulin-sensitive tissues in the skin. Symptom of diabetes plus a casual glucose greater than 200. Part of it. Native Americans, African Americans, and Hispanics should have routine checkups for diabetes. When screening children, if their BMI is above the 85th percentile for age and sex, family history of diabetes in first or second degree relatives, hypertension based on criteria for children, all of the above for that. Insulin is used to treat both types of diabetics. It acts by increasing peripheral glucose uptake by skeletal muscles and fat. Adam, remember, he has type 1 diabetes, plays tennis. He exhibits knowledge deficit about his insulin and diagnosis. And what we would teach him is he needs to increase his carbohydrates. Okay, and then the glucosine is the fast acting subcutaneous injection. It has the shortest onset compared to the other medications. The drug of choice for type 2 diabetes is metformin because metformin decreases glycogenolysis by the liver. Draws serum creatinine level to assess renal function. You want to do that before you give anybody any medication. But specifically to this, before prescribing metformin, I'm sorry, I take that back, not all medication. Before prescribing medications, You want to assess their creatinine and renal function because this is a medication that is excreted and goes to and through the renal system, the kidneys or whatnot. Okay. So now, sulfonylureas may be added to a treatment regimen for type 2 diabetics when lifestyle modifications and metformin are insufficient to achieve target glucose levels. Sulfonylureas have been moved to step 2 therapy because they have a significant risk for hypoglycemia. And that's your sulfonylureas. I know I'm like half but saying it, but you know what I'm talking about. Um, and this is, I want to add this when lifestyle modifications and the metformin are insufficient to achieve the target glucose. And that's when you could use the sulfonylureas. But they are step 2 therapy because they have a significant risk of hypoglycemia. So dipeptidyl peptidase 4 inhibitors, also known as gliptins, act on the incretin system to improve glycemic control. Advantage of these drugs include low risk for hypoglycemia. So when we're looking at like the gliptins, they are good because they have a lower risk for hypoglycemia. Okay. Control targets for patients with diabetes include a blood pressure less than 130/80. So control targets for a patient with diabetes includes blood pressure less than 130/80. You don't want to have a diabetic and a patient that also has hypertension. That's bad for them. So yeah. Establishing glycemic target is the first step in treatment of both types of diabetes. For type 1 diabetes, conventional therapy has a fasting plasma glucose target between 120 and 150 milligrams per deciliter. Treatment with insulin for type 1 diabetics starts with a total daily dose of 0.2 to 0.4 units per kilogram of body weight. A little calculation there, depending on your patient. Okay. When the total daily insulin dose is split and given twice a day, or given twice daily, which of the following may be followed? So when total daily insulin dose is split and given twice a daily, which of the following rules may be followed? Give 2/3 of the total dose in the morning and 1/3 in the evening. Right. All right. Well, now I'm going to give the 2/3. Studies have shown that controlled targets that reduce HbA1c to less than 7% are associated with fewer long-term complications of diabetes. Patients should have such a target include those with no significant cardiovascular disease. Prevention of conversion from pre-diabetes to diabetes in young children must take highest priority and should focus on fostering LDL levels less than 100 and total cholesterol less than 170, okay, to prevent any cardiovascular disease. So let's closely monitor children that may be at risk. Okay, so the drug recommended by the American Academy of Pediatrics for use in children with diabetes, depending upon the type of diabetes, are metformin again and insulin. Metformin is that go-to drug. Unlike most type 2 diabetics where obesity is a major issue, older adults with low body weight have higher risk for morbidity and mortality. The most reliable indicator of poor nutritional status in older adults is involuntary loss of 10% of body weight less than 6 months. Okay. The drug recommended for older adults with type 2 diabetes include second generation, I'm sorry, the drugs recommended for older adults with type 2 diabetes include third generation sulfonylureas. Third generation. Ethnic groups differ in their risk for presentation of diabetes. Hispanics have a high incidence of obesity, elevated triglycerides, and hypertension. Do best with drugs that foster weight loss, such as metformin. So those two answers are correct. The American Heart Association states that people with diabetes have 2 to 4-fold increase in the risk of dying from cardiovascular disease. Treatments and targets that do not appear to decrease risk for micro and macrovascular complications include glycemic targets between 7% and 7.5%. All diabetic patients with known cardiovascular disease should be treated with angiotensin converting enzymes, also known as ACE inhibitors, and aspirin to reduce any cardiovascular events. Okay, we know that stuff. Okay, so a diabetic patient with hyperlipidemia should be treated with HMG CoA reductase inhibitors. I will definitely look that up to make sure I know exactly what it is, but not tonight. Y'all saw me falling asleep. Both angiotensin converting enzyme inhibitors and some angiotensin 2 receptor blockers have been approved in treating hypertension in diabetic patients and diabetic neuropathy. So, some ACE inhibitors, some angiotensin 2 receptor blockers. And again, they are treating both diabetic neuropathy and hypertension in diabetic patients. Okay, protein restriction helps slow the progression of albuminuria, glomerulura. Why can't I say it right now? Probably because I'm sleepy. Glomerular filtration rate, which is the kidneys, okay? Rate decline in end-stage renal disease in some patients with diabetes. It's useful for patients who show progression of diabetic neuropathy despite optimal glucose and blood pressure control. So at this point, nothing's helping. Diabetic autonomic neuropathy, also known as DAN, DAN, is the earliest and most common complication of diabetes. Symptoms associated with DAN are resting tachycardia, exercise intolerance, and orthostatic hypertension. Diabetic autonomic neuropathy. So, okay. So symptoms of DAN, diabetic autonomic neuropathy, would include pain and numbness in the legs. In more severe cases, symptoms include issues with digestion, the bladder, and controlling the heart. Sorry, I got to send a text. Moving on. Okay, so resting, tachycardia, so we're talking about heart and exercise, which kind of going hand in hand. So if you're trying to exercise, your heart, you know, could be elevated, but they're saying that you could be sitting and having tachycardia at the same time. And then orthostatic hypertension, where your blood pressure drops, with movement, standing, you lay, sit, and stand, Okay, drugs used to treat diabetic peripheral neuropathy include gabapentin. The American Diabetic Association has recommended which of the following tests for ongoing management of diabetes? And that would be the HbA1c. Okay. Already over this. Moving on. So Allison is an 18-year-old college student with type 1 diabetes. She is on NPH twice daily and Novolog before meals. She usually walks for 40 minutes each evening as part of her exercise regimen. She is beginning a 30-minute swimming class 3 times a week at 1 p.m. What is important for her to do with the change in routine? And that would be check glucose levels before, during, and after swimming. Allison is an 18-year-old college student with type 1 diabetes. Allison's pre-meal blood glucose at 11:30 a.m. is 130. She eats an apple and has sugar-free soft drink at 1 p.m. before swimming. Her blood glucose is 80. What should she do? She should eat some carbs or eat a granola bar or snack with carbohydrates, CHO. Okay. So Bart is a 67-year-old man with type 2 diabetes mellitus. He is on glipizide and metformin. He presents to the clinic with confusion, sluggishness, and extreme thirst. His wife tells you Bart does not follow his meal plan or exercise regularly and hasn't checked his blood glucose for a week. Wow. A random glucose is drawn and it is 500. What likely diagnosis based on preliminary assessment? Well, it's not hypoglycemia. It's not infection. Hyperglycemic hyperosmolar syndrome. Um, I would say no. I would say diabetic ketoacidosis. But let's just double check HHS because I usually forget this one. Okay. So the symptoms of HHS is a very high blood sugar level over 600, mental changes such as confusion, delirium, loss of consciousness, dry mouth, extreme thirst, and frequent urination. Okay. All right, go back here. So, people with DKA may experience, let's see, fast, deep breathing, dry skin, mouth, flushed face, fruity smelling breath. I think that's always a telltale. Muscle stiffness, aches, being very tired, nausea, and vomiting. So, and we said that he presents to clinic confusion, sluggishness, extreme thirst, um, and he's just non-compliant. I thought it was diabetic ketoacidosis, but I believe it is going to be the HHS, the hyperglycemic hyperosmolar syndrome. What would one expected assessment finding be for hyperglycemic hyperosmolar syndrome? Would it be a low hemoglobin? Would it be ketones in the urine? Would it be deep labored breathing or a pH of 7.35? And we are going to definitely say deep breathing because that's what we read earlier. A patient on metformin and glipizide arrives at her 11:30 a.m. clinic appointment, diaphoretic and dizzy. She reports taking her medication this morning and ate a bagel and coffee for breakfast. BP is 110/7 and random finger stick glucose is 64. How should this patient be treated? Should we give her 12 ounces of apple juice with 1 teaspoon of sugar, 10 ounces of soda, 8 ounces of milk, or 4 ounces of orange juice, 4 cookies, and 8 ounces of chocolate milk? So this is kind of tricky because I always do sugar and orange juice, but I'm going to say the 12-ounce apple juice with a teaspoon of sugar. And I could be wrong. Y'all correct me if I am wrong. But I don't have the correct answer to that. So, bleh. Okay. And here we go. So this is men's patients. So the factor that has the greatest effects on males developing male sex characteristics is the androgen production. When assessing a male for hypogonadism prior to prescribing testosterone replacement, serum testosterone levels are drawn first thing in the morning. First thing. Some research supports that testosterone replacement therapy may be indicated in which of the following diagnoses in men. That will be, they have not been found to be helpful at all. Let's double check that. And let's just go back over that again. Some research supports that testosterone replacement therapy may be indicated in which of the following diagnoses in men. And wait a minute. Hold on. I might have. Nope, I'm sorry. That was the wrong one. That's the wrong answer. Actually, all of the above. So it would be age-related decrease in cognitive function, metabolic syndrome, and decrease in muscle mass in aging men. I apologize. Okay. Next, the goal of testosterone replacement therapy is testosterone levels in the mid-normal range 1 week after injection. So testosterone levels in the mid-normal range 1 week after injection. So that's the goal of testosterone replacement therapy. While on testosterone replacement, hemoglobin and hematocrit levels should be monitored. Levels suggestive of excessive erythrocytosis or abuse are hemoglobin at a 17.5 or hematocrit at 54%. And we remember that by let's just pretend we got 54 states and they all cost almost $18, so they $17.50. I don't know. Monitoring of an older male patient on testosterone replacement includes digital rectal prostate screening exam at 3 and 6 months. When prescribing Phosphodiesterase type 5 inhibitors, such as Viagra, patients should be screened for use of nitrates. Men who are prescribed these PDE5 inhibitors for erectile dysfunction should be educated regarding the adverse effects of the drug, which include hearing loss. Okay, so the PDE5 inhibitors can cause hearing loss. Male patients who should not be prescribed PDE5 inhibitors include those who have had an acute myocardial infarction. So it's really tough for anybody to get the PDE5 medications, or, like Viagra and stuff. If you have any heart problems, I advise you not to be trying to take those. So monitoring of male patients who are using PDE5 inhibitors include monitoring that blood pressure. Again, blood pressure is part of the heart, and we want to make sure that everybody is A-OK. So I think we got through that. Did I read that? Oh, which of the following is true concerning lesbian health concerns? The health risks associated with smoking, alcohol, and depression are higher than in the heterosexual population. Okay. All right. So this is hormone replacement therapy and osteoporosis. Okay, so the goal therapy when prescribing hormone replacement therapy, including reducing vasomotor symptoms. The optimal maximum time frame for HRT, or estrogen replacement ERT, is 5 years. So 5 years. Okay. And for men, it was, what was it? 6 months? Or 6 weeks? Oh, I got these things going everywhere. Or whatever. Okay. Dosage changes of conjugated equine estrogen Premarin are made at 6 to 8 week intervals. Ability to deliver high doses of estrogen. The advantage of vaginal estrogen preparations in the treatment of vulval vaginal atrophy and dryness is relief of symptoms without increasing cardiovascular risk. Oh, everything seems to affect the heart a little bit. Women with intact uterus should be treated with both estrogen and progestin due to increased risk for endometrial cancer if estrogen alone is used. I don't want that. Ongoing monitoring for women on ERT includes lipid levels repeated annually if abnormal, annual health history and view of risk profile, annual mammogram. Okay, give me a second. I need to get my cord so that my computer doesn't die. There we go. Okay, I am back with my black saggy eyes under here. Okay, so anyway, Christine would like to start HRT to treat the significant vasomotor symptoms she's experienced during menopause. Education for a woman considering hormone replacement would include discussing the advantages and risk of HRT. Angela is a Black woman who has heard that women of African descent do not need to worry about osteoporosis. What education would you provide Angela about her risk? Um, Black women are at risk of developing osteoporosis due to lower calcium intake as a group. I can see that being true. Okay, so drugs that increase the risk of osteoporosis developing include um, carban- carbamazepine. Okay, so carbamazepine, the drug that increase the risk of osteoporosis developing. Selective estrogen receptor modifiers, which another acronym is SERMs, SERMS, treat osteoporosis by selectively acting on the estrogen receptors in the bones. Sally has been diagnosed with osteoporosis and asking about the once a month pill to treat her condition. How do biphosphonates treat osteoporosis? By reducing bone resorption and inhibiting osteoclastic activity. Okay, let's see. Goal, okay, HRT is vasomotor symptoms. Time frame for HRT 5 years. And this is change conjugated 6 to 8 weeks. And the dryness is release of symptoms without increasing cardiovascular risk. Okay, let me see. Here's my chart. 3. Okay. Inadequate vitamin D intake can contribute to the development of osteoporosis by increasing calcium absorption from the intestines. The drug recommended as primary prevention of osteoporosis in women over age 70 years is alendronate, Fosamax. Okay. Primary prevention of osteoporosis in women over the age of 70, Fosamax. The drug recommended as primary prevention of osteoporosis in men over 70 years is also Fosamax. Okay. Ongoing monitor for patients over 65 years taking Fosamax or any other biphosphonate is due for annual renal function evaluation. Biphosphonate administration education includes requiring sitting erect for at least 30 minutes afterward. IV forms of biphosphonate are used for all the following except persons with advancing renal dysfunction. So, we're talking about these biphosphonates that you have to be particular about people's kidneys and make sure they're functioning properly. Again, a lot of medicines are excreted through the kidneys. That's why you have a lot of kidney failure and stuff. So be careful with that. What is the established frequency of repeating DEXA imaging after stating biphosphonates? There is no evidence-based timeline for monitoring after the first 2 years. So I guess that's still a work in progress. What is the duration of SERM use for menopausal issues? So that would be the bone health impacts long-term use. So for SERM, which stands for, we just saw it, where'd it go? Oh, that was there. You know what? I'm so tired I can't find it. Oh, selective estrogen receptor modifiers. Selective estrogen receptor modifiers is SERM. Okay. Why are SERMs generally ordered for women early in menopause? The rapid onset of severe hot flashes can be unbearable. Yeah, they can be. I saw my mom going through that, and it was no joke. Getting on down to the last two. Doo-doo-doo. Prescribing for women during their childbearing years requires constant awareness of the possibility of risk for silent bacterial or vaginal infections of the genitalia. Okay, intimate partner violence is a serious public health problem. It should be screened for at every encounter within the healthcare system. Because of their longer life expectancy, women are more likely than men to experience disabling common conditions in older women that can produce disability include depression, panic disorders, dementia. Okay. Gender differences between men and women in the pharmacokinetics include higher proportion of body fat. Yeah, women get fatter, so that lipophilic drugs have a relatively greater volumes of distribution. Okay. Okay. Treatment of PMDD that affects all or most of the symptoms include fluoxetine, so also a depression medication, so fluoxetine. Women are now the fastest growing population with HIV infection and AIDS. Wow. HIV infected women have higher rates of cervical dysplasia and HPV concurrent infections. Yikes. Maternal to child transmission of HIV infection during pregnancy may be prevented by use of antiviral drugs such as zidovine. Okay. Erroneous information about the LGBTQ individuals can lead to failure to give accurate advice to them as patients. Which of the following statements is true about lesbians? Lesbians as a group are less likely to have health care insurance. Okay. Didn't know that. Which of the following holds true for pharmacokinetics in women? Medications that involve binding globulins are impacted by estrogen levels. What are they doing to our estrogen, yo? The metabolism of drugs in women is primarily impacted by enzymes of the CYP450 system differences with men. Okay. So the metabolism of drugs in women is primarily impacted by enzymes of that CYP450 system. The interpretation of DEXA scores in the rare cases of adolescents, osteoporosis, and teens must use special Z scores developed for this reason. The timing of NSAIDs for best control of severe menstrual cramps include taking them for 2 to 3 days prior to the start of bleeding. However, some people whose period is irregular, that would be hard to do. Which of the following drug classes is associated with significant differences in metabolism based on gender? That would be SRIs, serotonin reuptake inhibitors. Since 40% of bone accrual occurs during adolescence, building bone during this time is critical. Ways to improve bone accrual in adolescents include encouraging daily dietary intake of 1,300 milligrams of calcium and 4 of vitamin D. So calcium and vitamin D, very important. Hot flashes are often a concern during menopause. Which of the following may help in reducing them? That would be increased intake of yams, carrots, and soy products. That seems to help. You can get it at the grocery store too. So, factors common in women that can affect adherence to a treatment regimen include all of the following except number of drugs taken. Women tend to take fewer drugs over a longer period of time. You think so? Okay, dysmenorrhea is one of the most common gynecological complaints in young women. The first line of drug treatment for this disorder is NSAIDs, your ibuprofen, those drugs, okay? Premenstrual dysphoric disorder, which is PMDD, premenstrual dysphoric disorder, occurs in a fairly small number of patients. Theories of the pathology behind PMDD that are supported in research include altered sensitivity to serotonin system. Okay. That's good. I just did it backwards. Okay, so that was red. Moving on to the last one. Yay! Okay, contraception. Women who are taking an oral contraceptive containing the progesterone drospirenone may require monitoring of their serum potassium. The mechanical action of the oral combined contraceptives that prevent pregnancy is progestins thicken the cervical mucus and slow tubal motility. To improve actual effectiveness of oral contraceptives, women should be educated regarding use of backup method if they have vomiting or diarrhea during a pill pack. Yeah, they go right through you, right out of you one end. A contraindication to the use of combined contraceptives is not on that page. Is a history of clotting disorder. So if you have a clotting disorder, you don't want to take oral contraceptives. Obese women may have increased risk of failure with which contraceptive method? That would be the combined topical patch. Ashley comes to the clinic with a request for oral contraceptives. She has successfully used oral contraceptives before and has recently started dating a new boyfriend. So would like to restart contraception. She denies recent intercourse and has a negative urine pregnancy test in the clinic. An appropriate plan of care would be through prescribe oral contraceptives and have her start them the same day as a visit with a backup method used for the first 7 days. Okay. Give it time to get in your system. When discussing with a patient the different start methods used for oral combined contraceptives, the advantage of a Sunday start over, the other start method is menses occur during the week. So you start on Sunday, you have your period during the week. Okay, the topical patch combined contraceptive like Ortho Evra is started on the first day of your menstrual cycle. So you put the topical patch on the first day of your menstrual cycle. Progesterone only pills are recommended for women who are breastfeeding, have a history of migraine, have medical history that contradicts the use of estrogen. Women who are prescribed progesterone-only contraception need education regarding which common adverse effects, and that would be irregular vaginal bleeding for the first few months. An advantage of using the NuvaRing vaginal ring for contraception is it does not require fitting and it's easy to insert. I beg to differ because I remember I was 18 and I got one and I could not get that thing to spring out or whatever. Okay, so oral emergency contraceptive plan B is contraindicated in women who may be pregnant. Well, that's pretty obvious. So, went through all of these. That was awesome. There's a lot to go through. It took a whole hour and almost 20 minutes to read every one of these. So, great. And that is it. So yeah, I going to keep on working and studying, and hopefully when I have my test, I can pass it. All right, guys. Have a good morning.